I have pasted my sir email ID on the chat box, sir. You can mail it, copy it from there, and you can send me, sir.
On the chat box.
Yeah, my email ID is SYED. You write it there
Yeah,
on the
yes,
compost mail.
yeah. SYED.
Exactly,
Syed
sir.
Faraz Ahmad.
Exactly, sir.
Syed Faraz Ahmad at clearnet.com. Is that the one?
Not that one, sir.
Ah,
Sayyed, I am just giving the full email ID. Just write it down. Just write it down. I am just rate
yeah, Syed
at the rate SYED at the rate
at the rate
IJCP
IJCP
group
group
GROUP.com.
IJCPgroup.com.
Exactly, sir.
Okay.
Once you send, sir, just let me know so that
I've sent it there
I
now for
can
you.
download and start this session. Okay. Okay,
Has
sir.
it come
Just
to you?
refresh the mails. I am refreshing, sir. Just give me a moment. I'm checking it. I haven't received till now, sir. Just I hope this time I have received my email. Let me confirm my email ID once again, sir. SYED
At IJCPgroup.com.
SY. I request all the, yeah, exactly, sir. You can see, sir, I have still not received that. I am refreshing my mail once again. Let me check, sir. Then we will be starting this session. I request
Yeah.
all the participants to be here patiently. There is some technical glitch. We will be starting the session in any moment. I'm not able to see the sir.
It has not come. Can I go on talking from here only?
Keep refreshing my mail ID, sir. Exactly. You
Okay, I'm okay now.
can do it, sir. Let me introduce you first. I cannot see the slides.
Okay,
You have
can I
used the email ID syed at the rate
SYED at the
ijcpgroup.com,
rate
right,
of
sir?
ijcpgroup.com.
Sir, but still I'm not able to find the email
Okay,
ID,
once
sir.
more I will try to do that.
That
Syed
your PPT is not
at ijcp
exactly, sir. That is the email ID only.
group
ijcpgroup.com, right?
dot com
SYED at the rate ijcp. Yeah, yeah, do it. Yes,
ijcpgroup.com.
sir. SYED at the rate IJCP group
Okay, I'm sending once more. You see that?
GROUP.com. Yes, sir.
How
Just
is it
share it
now?
now so that
You got it?
yeah, sir. Sure, sir. I'm just checking it. Give me a moment. We are really be patiently. We are going to start it in a moment. No, sir. I'm refreshing it again. I can't see the presentation. I don't know why it is happening. I'm not able to see the presentation, sir. Sir, you can do one thing. Can you reply to the Nishita that email ID, if possible? Hello, sir. Can you hear me?
Yeah. Tell me. Oh, that is
Hello, sir.
Syed
Can you hear
Faraz.
me now?
Yeah, now I
Yeah,
can
you
hear
can
you.
do it one thing, sir. Can you please? Yes, sir. Can you please reply to the Nishita that email ID, Nishita Mukherjee?
Okay, Nishita.
I think there is some issue with my email ID because till now I haven't received that mail. Yes, sir. I can see the PPT, sir. Now I am able to see, sir. Just let me
Okay, you're
download,
able
sir.
to see?
Yeah, yeah, I have got it. Just it getting downloaded. It's not opening, sir. It's like no preview. It is showing key, something like that. It's modified prevention dot key, right? The file name is that. Just I am clicking into that. Sir, what to do, sir? It's not it.
I will go on presenting it from my side. Don't worry, from my PowerPoints.
Yeah, sir, you can try it, sir.
That is fine. Okay,
Yeah,
let us
sir.
start off with. Let us not make the audience to stay. I'm extremely sorry for the delay that I have. Okay, you just introduce the for me, and then I will go ahead. Okay. Raj, is it okay?
Sir, can you hear me now?
Yes, for us.
Yes, sir. I think there is some issue from the network end, sir. With all your permission, I mean, starting with the introduction part.
Okay, no problem. Go ahead.
Yes, sir. Yes, sir. I'm just starting. Good afternoon, everyone present here. I welcome all the participant doctors on today's session. Let's welcome today's speaker with great honor, Dr. Ramamurthy Bimni, sir. Sir has done MBBS, MD Medicine, DM Cardiology, Interventional Cardiologist at Bimni Heart Care and Fertility Center. Today he is going to speak on a topic CVD prevention. Let me tell you overview of the topic. Globally, cardiovascular disease, that is CVDs, are the leading cause of death. There are many risk factors associated with heart disease and stroke. While certain risk factors such as family history cannot be changed, other risk factors such as high blood pressure can be changed by dietary changes and medical procedure. To learn more about how to prevent and reduce the risk factor of cardiovascular disease, now I would like to invite and hand over this session to sir. Over to you, sir. Kindly proceed from here.
Thank you. Thank you, Faraz. Faraz has already given a nutshell what is the real focus that should be as far as the prevention of cardiovascular disease is concerned. In fact, it has become a sort of a globally challenging issue. not only for the developing countries and as well as for the developed countries. Fundamentally, the blood vessels become diseased, and they become diseased with the building up of the plague, what we call as an atherosclerotic plague. And with the various concepts earlier, it was what is called as an injury to response, lipid hypothesis, incrustation therapy, and the like. But now we have understood whatever the factors that are there, which are circulating in the blood as well as in the blood vessels, they are capable of injuring the endothelium, and that makes us the starting point. So we have come to the concept of unifying concept of the injury concept of development of atherosclerosis, that is injury to the endothelium layer, and in a generic term we use it as the endothelial dysfunction. This endothelial dysfunction is the starting point for the development of the lipid accumulation, what we call as an atheroma. If these atherosclerotic plaques happen in the arteries of the heart, we call it coronary atherosclerosis. They happen in the carotid arteries. They can happen in peripheral vessels, peripheral arterial disease, carotid arterial disease, and the like. Which is the overall burden problem as far as the society is concerned, is due to the cardiovascular diseases. We call them as CVD. And there is a big scope for the prevention of this. These are not diseases just like our malaria, cholera, or dengue fever, where there is an inciting agent, identifiable agent. There is no identifiability, there is only an association. So we can recognize these associations and try to modify them. Now, the main issues as far as this atherosclerotic disease is the development of the so-called acute coronary syndrome, development of heart attack and unstable anginas, and in the cerebrovascular field, it is most of the time transient attacks or strokes. Sometimes the stroke, which are because of the hemorrhages within the parenchyma, hemorrhagic strokes, and it is also responsible for peripheral vessel diseases as far as these various territories are concerned. Now, equally, the thing that has to be taken into consideration is it is also responsible for the development of heart failure. In fact, heart failure, when we consider it as the end stage of the various heart diseases, it's not so. It has emerged as a very important entity, medical entity that needs to be managed, and the atherosclerotic vascular disease of the heart and other things are responsible for the development of heart failure. And equally, there can be the development of renal failure, aneurysmal formation, and the like. But more important from the clinical point of view, the development is so-called sudden cardiac arrest. And from the preventive aspect, we know that we always say that an individual who develops an acute coronary event has got a tendency to develop one more event within the span of about 1 year time. So the recurrent heart attacks, the recurrent cardiovascular events, with each occurrence, there is an element of sudden death or a problem of having an increased mortality. So these are the recurrent heart events also should be kept in mind. Now, when it comes to this sort of a thing, let me take your diversion a little bit on what is called as, can we prevent these diseases? Is the diseases you are saying globally in India, there is so much of a problem. You know that there is no identifiable cause, but there is some association factors, what we call them as the risk factors. Can we do something to prevent these effect of the risk factors and the effect of these risk factors on the heart and the blood vessels? Now, here we have divided these so-called risk factors into the modifiable risk factors and the so-called non-modifiable risk factors. Faraz brought out this issue. There are some factors which are major factors. Some of them are called as minor factors. The major factors are concerned are the diabetes, cholesterol, high blood pressure, and smoking in men. And we have also started slowly recognizing physical inactivity and stress are also important factors. The beauty of this so-called risk factor concept is that they often try to go together. Blood pressure, diabetes, cholesterol, blood pressure together, and the bad habits of smoking along with this entity. So this sort of a phenomena, we call it as a clustering. This phenomena we should exploit not only as individual doctors, but also policymakers and preventive strategies to identify them by various clinical examination and doing some laboratory tests and approach in the so-called totalitarian approach in preventing the heart diseases. Now, there are some unmodifiable cardiac risk factors, which is not in our hands, but we should try to know them. For example, being as born as a male, being aging, the coronary artery diseases and cerebrovascular diseases are more common as we go on aging. Similarly, there is some racial phenomena. Now, 20 years back, there was a lot of hue and cry was made out. Asians population per se are more prone to develop coronary artery disease, and of course the family history, genes, and these factors usually you cannot modify them. But whereas hypertension, diabetes, and cholesterol, you can modify them. And equally nowadays, we have started recognizing some other factors. Slowly and steadily, there is an association with the coronary artery disease, but their understanding their impact and utilizing these recognition of these factors in the routine evaluation may take some time. For example, many physicians have understood patients do often have low vitamin D levels. There is an association. The patients often have low vitamin B12 levels. There is an association. There is a subclinical thyroid problem. There is an association. So many things are coming. And earlier, when we were studying, we used to talk about high-level fibrinogens and LPL level, little protein, this thing, fibrinogens being high, and the factors like that. But now we have recognized because of the so-called health checkups, more and more of these other factors also. Now, in this game of prevention of coronary artery disease, how do you recognize? Patients, if they have symptoms, they come to you, you recognize the disease, well and good. But it's our responsibility as healthcare givers. We have to see that these patients can be divided into so-called low risk category or high risk category. And those who are health conscious, what is called as the preventive health examination, cardiac examination, and general examinations. Some of the blood tests that we do, like lipid profile, blood sugar, and things. Some basic investigations like ECG, echocardiogram, treadmill testing, judicious use of myocardial perfusion tests. Now we have available so-called CT coronary angiogram in some high-risk cases. MRI is emerging in a big way. Of course, everybody knows about coronary angiogram. Using these modalities, we can recognize. This applies to the not only the coronary bed, but also in other beds also. Recognize the various disease entities. Now, coming to the major risk factors, often when my patients come to me and ask me, I always tell, look, these are the three trios. They are the most deadliest ones. I often call them as rakshas. Okay, one is blood pressure, another is the cholesterol, another is the diabetes. And of course, the blood pressure is an important element, and cholesterol is also important. We have got various scientific evidence starting from the 7 countries diet evaluation study, and then the evaluation of total cholesterol with the coronary risk factors. We did recognize higher the cholesterol, there is a tendency to develop coronary disease and cerebrovascular disease. And this was further on clarified by the so-called MR-FIT study, then the Framingham study, there's so many things came. Yes, you showed their association, higher the cholesterol, it is bad, you may develop the problems. But have you done some studies to show that to reducing the cholesterol reduces or prevents these coronary problems or stroke problems? Yes, these are called as the intervention trials. We have a hell of a knowledge that is available. Controlling the cholesterol, bring it down below the normal range, often prevents subsequent events. There is a little bit of a controversy whether this sort of a concept has to be used as per the drugs are concerned, apart from the diet, exercise, thing. In every population or in only some high risk population, is it a primary prevention strategy, secondary prevention? I don't want to highlight that, but reducing the cholesterol apart from the diet by the drugs is possible. Now, you have come across many a times cardiologists writing what is called as the lipid profile. The total cholesterol alone is not important. So we have what is called as LDL fraction, HDL fraction, VLDL fraction, triglyceride fraction. Though there was not such a strong association between triglycerides and coronary artery disease, now various studies have shown that there is such an association. And hence, whenever you ask for a laboratory evaluation, you should ask for what is called the total lipid profile. And apart from that, laboratories are giving so-called ratios. Some laboratories are doing LPA tests and other thing. But these are fundamental. LDL cholesterol, HDL cholesterol, and doing an triglyceride level. And HDL cholesterol has got an inverse relationship. More the bad cholesterol, total cholesterol, and LDL cholesterol, more is the risk. But whereas HDL, if it is more and more, it is a sort of a preventive phenomenon. That is how it is at inverse relationship. Lower the HDL, it is bad. For your remembrance, HDL values are relatively low always in men compared to women, particularly the women who are in the menstruating phase. And probably it is then related to the estrogen hormones and a God-given gift to them. And how the men folk have to do increase this. Men folk have to increase their HDL values more and more by doing exercise and some diet modifications. How do there are some cut figures. The cut figures are changing. Let me not go into the details of that. The cholesterol values, blood pressure values, blood sugar values, day by day, new scientific evidence is coming, and we're coming lower and lower. Once upon a time, we used to say 140/90 is the blood pressure, but now we say we should bring it to 120/80. High risk categories to no high risk categories, high normal pressure, pre-hypertension. So many concepts are coming. Similarly, with cholesterol, earlier we used to say total 200 and below, and LDL 100 and below. Now they say 75 and below, HDL above 45. Like that, we are asking more and more. But you should remember some of these figures because you may have to think of them when you are managing, but you should be not strictly adhering to that sort of a thing. It is the quality of the life of the patient that is being affected. Try to bring it as much as possible to the low and try to look at all the factors together. And in the Indian setup, we have a peculiar problem of high triglyceride and low HDL value. And it itself is a very burning issue, particularly in a diabetic population. I'm not going to highlight about that. There are additional medications needed apart from the cholesterol reducing medicines for this sort of patients. Now, how do you reduce the cholesterol by diet? We are talking about the prevention apart from high risk or a very high level cholesterol where you are using the medication as a secondary prevention using the medication as a primary modality. How do you control or reduce the cholesterol without medicine? One is basically we have to eat a very heart healthy diet. There should be more and more fiber, the less of fat, less of carbohydrate, trans fatty acid related foods like mirchi, bondas, and other things should be cut down. Margarine should be cut down. and we should do the exercise regularly, lose the weight, and try to maintain an ideal weight. Both of these factors have been shown to reduce the cholesterol values also. And of course, stopping smoking and stopping alcohol also. Newspapers and YouTubes are all talking some of the alcohols are better, some of the alcohols, particularly wine varieties, better. As a doctor, I would advise, and you should also advise, not to make it as a sort of a drinkable habit. Some social drinking alone, but not as a sort of a regularity. And of course, apart from the diet, we have to use the drugs. We call them as statins. We have also other medications. These drugs have particularly been shown not only reduce the cholesterol and reduce the coronary risk, but probably they do more risk reduction than the cholesterol values itself. And we have recognized and we're coining a special word, what is called the pleiotropic effect of the cholesterol reducing agents. There are additional antioxidant properties, endothelium stabilizing properties, and anti-inflammatory properties and the like. And they're also beneficial in preventing the coronary diseases. And as for the blood levels, what was showed, I made a passing remark. Let me not highlight on that. Hypertension, high blood pressure is also abnormal. Remember, whenever in the beginning only I said this blood pressure, blood sugars, and cholesterol, they are very bad trios, and they are like rakshas. So they are together, there is more harm. For example, if the patient has got a 150, 100 along with the 210, 230 cholesterol, there is a high chance of developing. A funny point is blood pressure diagnosis is easier. You need not depend on the laboratory. You can do the examination. Please, kindly, all of you, make it a point to examine the blood pressure. Okay. Don't go by the way the scientific suggestions that are being done. Keep one figure into the mind. If you find that in your office level 140, 90 and above, try to treat it. Because in the beginning, blood pressure should be managed by the so-called non-pharmacological methods. And the non-pharmacological methods is concerned salt restriction, weight reduction, reducing the obesity, doing regular exercises, and stress modification. And we have also recognized a third important risk factor as the smoking, nicotine effect. And there is a strong relationship. We have recognized that young people below the age of 40, 45 developing a coronary event, having one single vessel disease, most of them are related to cigarette smoking. And we have a done study from Bangalore and from one of my senior colleagues, they have done that the BDs that the people smoke in the rural areas are as bad as cigarette smoking. And we should discourage both of them because we have noted the effect of stopping these things is seen as early as within a month period time. And there's no need of waiting for a long time. The other risk factors that we have recognizing is obesity, of course, abdominal obesity, and there is no doubt we Indians are becoming slowly inching into the obesity range. Even though our people are not obese, as we see in the English movies, we do see our people are having a lot of a big tummy, relatively small limbs, thin limbs, and what we call as an abdominal obesity or border obesity is a very important risk factor for the development of both the diabetes, metabolic syndrome, as well as premature coronary artery disease. And we have also recognized psychosocial factors, then ethnic factors, and then educational levels. They're also important in coronary artery disease, but let us not highlight them. This is some of the factors which have narrowed the real prevalence pattern between the rural areas and urban areas. The disease is catching up very rapidly even in the rural areas. The ponderal obesity is probably the precursor for even development of diabetes. We are recognizing diabetes is become a very important factor. Earlier studies, they never gave importance as a major risk factors, because often when we try to analyze the diabetes, there are many more associations. Bad cholesterol is high, then triglycerides are high, HDL values are low, and they have some amount of blood pressure and the like. When the multivariate analysis was being done, they made out diabetes was not such an important factor, but now it's an important factor. We know it, and the prevention of diabetes and management of diabetes is a very important fact. And ask for any diabetologist, or leave alone me as a cardiologist, they all say diabetes can be controlled, diabetes can be prevented in the beginning itself. The triads are food that we eat, the activity that we choose, and regular health checkups that are very important as far as the diabetes management is concerned. So it boils down to looking at the risk factors and managing them, and also doing some lifestyle modification. So these are called as the healthy heart habits. We should learn these healthy heart habits and try to promulgate into the preventive program. Regular exercise, good nutrition, and stop smoking, and not taking alcohol and other things, very important. Now, fundamentally, exercise is important. I feel very sorry to see that every one of us, not only the doctor community, but not doctor community, is all pressed for the time. We don't do enough exercise, neither at the place where we're working, nor as a sort of an regular physical activity, just going for about 20 minutes to 30 minutes of exercise. Don't go by the various minutes of how much a minute of exercise needed, 30 minutes, 20 minutes, 40 minutes, 1.5 hours. Do it according to your level. And the more the exercise you do, it is at the point of reducing your obesity factor. Even 20 to 30 minutes is enough for the control of sugars. 30 to 40 minutes is enough to maintain your the so-called heart health. So exercise should become an important issue. In that, the focus should be given more for aerobic exercises like jogging, like walking, running, jogging and running in between, swimming, cycling. Cycling and walking can be done by anybody, and we should make it into a regular habit. We have recognized that the exercise is capable of producing more and more nitric oxide, a very powerful vasodilator. As I said in the beginning, endothelial dysfunction is a fundamental issue. So if you produce more and more nitrous oxides, you are going to help the vasculature. And apart from that, it has been shown to reduce the bad cholesterol. It increases the HDL values also. It gives a sort of nice psychological well-being. The anxiety part and the depression part come down. And we have also shown regular exercises by various trials data that it reduces the mortality also. And that is how structured exercise program has become an important element apart from this various dietary and drug management in the secondary prevention. And unfortunately, majority of the institutions do not have this so-called structured exercise program for rehabilitation purpose. At least as an individual physician, we should try to encourage the individuals to practice both at primary and secondary prevention level. And the particular time and particular variety, gym versus non-gym, they are not necessary. You should try to do aerobic, just like walking or jogging is the best. You can do any time of the day. And I usually ask my people, don't go by this one. Of course, there are some smart watches have come, then the iPhones have come, where they can make out the time, the steps and all that. But I say you should do enough amount of exercise in such a way. You put your back of your hand onto your nape of the neck. You should be starting mild sweating. That is enough. Good amount of exercise. I feel this is a sort of a monitor that you are doing. Of course, in the diet, apart from reducing the cholesterol part, we should not end here without mentioning the salt reduction. All over the sugar and salt restriction have become the major words that are being talked about. Salt is directly related to blood pressure, and there is an if you reduce the salt, there is an indirect improvement of the blood vessel reactivity. Okay, and this can be done by just avoiding some extra salt that we usually use, particularly, you know, Indians are very fond of the pickles and papads, and of course, the youngsters are becoming more and more tuned to the so-called fast food junctions. As seniors, we should discourage all these things. Now, another important point I would rather highlight here is eating more and more fiber foods, eating more and more fruit and vegetables. It has been shown by the studies, pool data. It not only reduces the blood pressure, it also reduces the risk of coronary artery disease. We should use more of vegetables and fruits in our food. A fundamental thing I would say, it applies to me, it applies to you, all of you who are doing the day-to-day morning to evening, busy with your own practice. Kindly make it the work activity as also part of an exercise out of the program. Just move your ass from the chair that we're sitting. That is the best method of preventing ourselves. And let me not go into the diet and diet pattern, the diet issues are there, and it's a fundamental knowledge. All of you have it, and I don't think we should be worried about it. More than the prevention, as an individual effort, doctor to patient, it should become a sort of a movement. In the movement, there is some government agencies and non-government agencies that have to take place. But we should not sit back. We should try to encourage them. More than that, our major effort lies in educating the family. When a patient comes to us, he always sits alone. No, should make see that his wife and children are sitting with the others and try to encourage them to follow the important dietary habits and encouraging them to do the exercises. So I think I have tried to cover up as much as possible preventive strategies, what you should advise to the patient, what you can also follow by yourself. And this is how we should try to prevent this so-called menace. Present day, it is a real menace of the society. We should prevent the various cardiovascular diseases. Thank you very much for your patient hearing. Any questions or any thoughts?
Yeah, sir. Thank you so much, sir, for giving your valuable time and sharing your knowledge with us and making this session informative one, sir. I definitely think this session knowledge is going to help all the participant doctors on their practice also. Sir, we have received some questions, sir. If you allow, with all your permission, can I take this question?
Sure, please.
Okay, sir. The question is from, I can see the first question is that what dietary changes can be made to reduce heart disease risk?
As I stressed, the diet is there now. Basically, we do eat in a plate, having some chapati, roti, vegetables, rice, and other things, is it not? So it should be a very mixed, balanced diet. Usually the dietitians say, and I also say, when you fill the plate, it should be only 3/4 filling. 1/4 filling should not be there. Out of this 3/4, you should have one of that, maybe something to do with the dal. It doesn't matter if it is a very small amount of a rice, but not regular amount. You can eat many other things. Vegetables should be 1/3 vegetables and fruits. And proteins, unfortunately, in Indian setup, proteins are less. I have not spoken about this. So I said dal. any of the so-called didal dhanya, dal and other things, including peas, nuts, there should be about 1/3. See, if you follow the simple principle, things will be taken care of. Well, the excess oily food should be cut. I usually try to give a recommendation. It is not by any books or any dietary protocols. If you are in a family of 3 people, 2 husband and wife, and 1 child or a grown-up or growing up child, it should not be more than about 2 liters of oil per month for cooking. Okay, in Hindus, there is a tendency to the same oil even for puja. So you should use the quantity in that manner.
Okay, thank you so much for answering, sir. The another question is that is cardio the only exercise that maybe prevent the heart disease?
No, I have spoken only about ischemic heart disease. There are many diseases like congenital heart diseases. We know that though we do not know exact reason, we have some environmental factors in the mother's womb that can create so that we can prevent rheumatic heart disease. Everybody knows penicillin prophylaxis is good. So like this, there are some many diseases which can be prevented. I'm sorry if I have spoken only about ischemic heart disease because that's the major issue today now.
Okay, sir. Thank you so much, sir. I can see another question is that uh, I take a Varafin, Metoprolol, and Digoxin daily. I still experience a arterial AF usually 3 times a week. Is ablation the answer to getting off all this medication?
This is a relatively tricky question. Okay, you have been taking medicines for 2 reasons. One is, of course, to treat your atrial fibrillation. Atrial fibrillation has always a tendency to remain with that, and it has got a tendency to produce 2 problems. One is, of course, it becomes symptomatic and irregular pulse. It can produce clots inside and they may go to the brain and the like. So we give some medicines, you have to take them. Okay. There is nothing like coming and going, coming and going. We call them as paroxysmal. Many times the patients do come and get admitted. Not like this, coming in 2-3 times in a week. Like majority of the time, they do happen, and then they establish themselves as a chronic atrial fibrillation. Another is the chronic atrial fibrillation per se is because of many times ischemic heart disease, hypertension, LVS thickening. It is also because of dilated heart failure. So some of these reasons we may be giving some medicines, like statins we may be giving, ACE inhibitors we may be giving. So you have to take them.
Okay, thank you so much for answering it really well. I hope that this participant has received the answer. And one last question is, sir, hypertrophic cardiomyopathy, that is SCM for 4 years. What advances have been there made in minimally invasive surgeries?
Minimal invasive, we have been trying to do what is called as an, the catheter-related ablation therapy by alcohol. Okay, we have to select the cases. We have to have some particular thickness. There should be an LVOT obstruction and the like. This is the minimum. We can go through the groin, put the catheter there, and okay. Other than that, the time-tested treatment as far as the symptomatic hypertrophic cardiomyopathy all over the world is the septectomy, septostomy. That's what we call septectomy. Understood. But if you are not having cardiologist and asking what exactly you would like to do, we can do ablation.
Okay, sir. Thank you so much for answering all the questions, sir. It was really wonderful explained from your end. I hope that all the participants have got their answer. Answer as there is no more question. With all your permission, shall we conclude this session?
Thank you. Thank you very much. If at all I have done any sort of mistakes, pardon me, but I try to give my best advice to all of you. so that
Yes,
you
sir.
can
Thank you so
practice the
much.
same thing to the patients and people. Okay.
Exactly,
Thank you
sir.
very
And
much.
I hope that
Thank
the
you very
template
much.
which is
Thank you.
happened.
Thank
Yes,
you.
sir. Take care of yourself, sir. Hope
Thank
to
you.
see you
Thank
again
you.
with different
Thank,
topics, sir. Goodbye.
thank you
Thank
very
you.
much. Okay, bye. My special thanks to all the CP group. CP group, thank you very much.
Okay, sir. Thank you, sir. We are very glad to have you on our platform, sir. Thank you once
Thank
again.
you.
Welcome, sir.